Welcome, and thank you so much for joining us today. I'm Dr. Abby Zoltik, Director of Education for the Veterinary Association for Farm Animal Welfare. For those of you unfamiliar with VAFA, our mission is to advocate for animals used in food and fiber production by providing a veterinary perspective grounded in animal welfare science and ethics. We accomplish this through education, policy development, advocacy, and collaborative animal care. VAFA currently has three areas of focus: preventing and mitigating pain experienced by farm animals, promoting living environments that meet the animal's physical and psychological needs, and lastly, ensuring humane end-of-life practices. If you are not yet a member of VAFA but would like to become one, please send us your name through the Q&A box located at the bottom of your Zoom screen, or visit www.vafa.org. Membership is open to anyone who supports our mission, and the first year of membership is free. Membership renewal emails started going out a couple of months ago. If you're not sure whether your VAFA membership is current or requires renewal, please type your name into the chat or send us an email at info@vafa.org, and we will get back to you with an update on your membership status. Today's presentation is part of our webinar series that focuses on pain prevention and mitigation in farm animals. Farm animals routinely undergo painful procedures and commonly experience painful disease conditions. And while there are numerous drugs that can be used in an extra-label manner to effectively reduce pain in farm animal species, there is currently only one FDA-approved drug labeled for this purpose. VAFA aims to increase effective on-farm pain management, improve pain recognition, and reduce the prevalence of painful procedures and painful disease conditions. This includes supporting research that aims to validate pain measurements and evaluate analgesic efficacy in farm animals, essential steps for FDA approval of medications labeled for pain control. VAFA supports evidence-based extra-label use of existing analgesic options and encourages the development and FDA approval of analgesics that are cost-effective, with convenient routes of administration and long durations of pharmacological activity. We are very fortunate to have Dr. Eduarda Bortoluzzi here with us today to speak about pain in cattle. Dr. Bortoluzzi is an assistant professor of animal welfare in the Department of Anatomy and Physiology at Kansas State University. She earned her veterinary medicine degree from the Federal University of Pampa, Brazil, followed by a master's and PhD in animal sciences at Kansas State University, where she also served as a postdoctoral fellow at the Beef Cattle Institute. Dr. Bortoluzzi's research centers on improving the welfare of domestic animals, with a particular emphasis on applied ethology and innovative approaches to pain recognition and management. Her work is at the forefront of identifying tools and techniques for effective pain assessment, drug approval, and pain management strategies in cattle and small ruminants. After Dr. Bortoluzzi's webinar, we will follow up with a question and answer session. Throughout the webinar, you are welcome to submit your questions through the Q&A button located at the bottom of your screen, and we will address as many of these questions as time permits. Thank you so much for joining us today, Eduarda, and I will turn things over to you.
Thank you, Abby. I'm going to pull my presentation here. So you might see my messy, how you call that? My messy desktop for a little bit. Okay, let me share this. I'm going to pull. And here, can you guys see that okay?
Yes, we can.
Okay, perfect. So first, I would like to thank VAFA for inviting me to talk about recognizing and managing pain in cattle. This is something I'm very passionate about. I've been working with cattle since I started my master's. Kind of fell in love with cow-calf producing and how much care the producers have for their cows and how much they do for them. But I didn't realize that how strict we are in what we are using as far as pain management for those animals because of the lack of drugs that are labeled for that purpose. So what I'm going to talk today is a little bit of my work, but also some background. Oops, let me go ahead here. I have some conflicts of interest to disclose. You guys can read through those. Most of them are just funding for my research. And then what we're going to discuss today is why is pain management important? So why do we need to keep looking into ways to approve more drugs or to recognize pain? What are some of the association guidelines that we have available? So for producing animals, where can we look at those information, what guidelines that they have, what they're telling us to do? Why is managing pain livestock challenging? So why do we have such a hard time to approve drugs and to use those drugs in livestock since we have so many other ones in small animals? And how do we access pain in cattle? Some methods and some challenges that come with those methods. What is the current landscape of analgesic use in the USA? So it's going to be different. So I'm from Brazil, so in Brazil is very different from USA, which is different from Canada, which is going to be different from Mexico. So each country will have some sort of different ways that we can use drugs to manage or mitigate the pain of those animals. But we're going to focus on the US and what is being done to move forward. So what will be done as far as research to improve or to move forward with those drugs being approved? How can we label more drugs? What is being done? So to start off, we're going to talk about why is pain management important. So if we think about some just management things we do for cattle in US, uh, about 15 million of calves undergo painful processing procedures such as dehorning and castration. That number probably has increased in the last few years because we are now introducing beef on dairy. So beef on dairy are animals that um, they come from the cross between a beef breed, so an Angus breed, for example, and a Holstein. So before that, on the dairy side, we had a lot of what we call surplus animals. So male animals that were born at the dairy that didn't had a value. So those animals were either, sold for veal or had very little value that it was almost they would go and do euthanasia on those animals because they didn't had an outlet for those animals. Right now, what they're doing is using sex semen from Angus, for example, to inseminate those cows so we can have an animal that has a value. But with that, it will come a lot more males to go into the beef industry, and that will also increase how many animals we have undergoing those painful procedures. The nice thing about those animals is that they're usually pulled because of the Angus genetics, but we still have all our heifers going through this budding because they're Holsteins and they will have horns. So all physical methods of castration, disbudding, and dehorning will invariably cause pain and distress in cattle. So unfortunately, we don't have a good way of mitigating those pain. And mind you, no matter what type of procedure we do, we know that we're going to cause some type of pain to those animals. Besides that, there's a lot of other disease processes and some things beyond our control that cause pain. For example, things that we don't see as painful very often is, for example, bovine respiratory disease in feedlot cattle. So you're going to see that a lot with animals that have that BRD. So their lungs are suffering with a disease process that can be viral or bacterial or a combination of those two. Those animals have a hard time to breathe, so that causes pain and distress to them. So I have a picture here just showing one of those animals kind of in the heat of the summer trying to get some air into their lungs, and their lungs are shut. So it's for sure those animals are undergoing stress and some sort of pain because it can cause some adhesions to the tissues, and will make that animal suffer. Right now, we don't have a good protocol to control pain in those animals that have those diseases. We usually try to treat the root of the disease, so treat with antibiotics, but we don't have a good way of treating the pain of those animals. The other one very common that we see is neonatal septicemia or septic arthritis. This is a case that we had with one of the animals that we had in research. Unfortunately, that animal came with very low um, IgGs or immune passive transfer. So we probably received a really poor colostrum, had some infection in the umbilical cord that became septic, and then it ended up in the joints. And then we had some lesions that are for sure very painful for that animal since they use those limbs to get up and to lay down. So every time that they use those limbs, it causes pain to them. But the one that we always focus on, and the one that I do my research on, is this budding castration. So just to give you some examples, this budding is usually done using a hot iron cautery. So basically you're gonna burn that tissue around the horn. So by separating that, that horn is not gonna grow. So we do that. Or we can use paste that is also painful because it's a caustic paste that will kind of burn the the horn before it gets attached to the skull. And then we have castration in different methods. So we can have closed castrations or open castrations. A surgical castration would be the one that we make a cut, we remove the testicles, and we let it heal. And then we can have closed castrations like using a band, for example. If you show a picture of a calf that was castrated with a band and a calf that got castrated with a surgical incision, most of the time, for people that don't truly understand the two different processes, they tend to say that the surgical castration causes more pain because you can see a lot of blood, right? So it's very graphic for people. However, when we get to the stage that we are here with the banding castration, we have that band cutting through the tissue and exposing some of the granular tissue that is growing to try to heal the wound. And that is very painful for the animal. So it's a more chronic pain. It takes longer to heal compared to a castration that we do surgically. But to me, the main reason why I research is because I think it's important for the animal. So I answered a couple of questions in an interview one time, and then I went back and I read what I said. And this sentence I said really resonated with me. I said, yes, it's important that, we are having some production outcomes and we can see some differences in behavior. But in the end, it's also about doing what is right for the animals, right? We know that it causes pain. So how can we do at least the minimum to provide some analgesic relief? So to me, it's about the animal. How can we help the animal? I think nothing that we do in humans we do without pain control. So it's very crazy to me that we believe that animals don't feel the same when we do those procedures in them. So one thing that it kind of leads me to the path of looking into pain is that those procedures that cause pain and distress to animals, they're likely the most contentious of all animal welfare issues. And that happens because in the past, there were a lot of people that thought that the animals didn't feel pain the same way as we do. So it kind of causes this friction between people that are very empathetic towards those animals and people that have been working with them and kind of lose that empathy over the years and don't see those signs of pain. So it's very like it's very controversial. It's also very hard because there's always the concern about which type of drugs we can use, what is the withdrawal time, how can we be more effective, how long that drug lasts. There's so much going on around the pain and distress of those animals that we don't really understand or we don't know how to fix it. But when I saw this sentence on the welfare of cattle, that really resonated with me. So, intentionally causing pain to another human is considered repulsive in most societies, and causing pain to animals normally generates a similar response. However, when we look at animals, there's a big difference to domestic animals that we have inside of our house and domestic animals that we use as food and fiber, for example. So there is some sort of um, attachment to dogs and cats, and as we see them as part of the family, that we're more willing to provide them some pain relief compared to our food animals that we have less of that relational perspective. So yes, it's repulsive in most of societies, but sometimes that is not what we see when people are working with livestock species. So, because of that, I always like to bring the other side of things. I try to bring the sustainability, the profit, how this also affects what they are selling as far as a producer or someone that doesn't truly believe that animals can feel some sort of pain. So nowadays we know that consumers are keeping an eye on everything that we're doing as far as livestock. They want to know more about how animals are produced. They want to know where their meat is coming from, where their milk is coming from. They want to make sure that they are buying from reliable sources that care about those animals, that do everything that they can to keep a good animal welfare. So by having those eyes into what products that we are putting in the market, they might be very selective about buying animal products. Either they decide they don't want to buy any type of animal products anymore, they don't want to support the industry, or they start being very selective of like, I'm gonna buy from this source that has this label, but I won't buy from this source that doesn't have that label or an animal welfare type of label. So unfortunately, there's still this gap between the knowledge about farming and the knowledge about welfare that the consumers lack, but we also lack on the part of the producers and how we communicate on how much we care for those animals. But this influenced very significantly the sustainable agriculture. So, what is sustainable agriculture? Is being able to maintain at certain level and avoid depletion of natural resources, and being able to uphold or defend what we're doing as far as raising those farm animals. So there's an economical component where we want to make sure that we keep doing everything right as far as the environmental part of it, so we can have that upcoming on economic. But there's also the ethical part of what we're doing. Are we doing the best we can for the animals we are raising? So there's with this increase in the consumer view of animal welfare, and because the consumers put animal welfare as the most important pillar of sustainable agriculture, this evolution of public perception really kind of molds where we're going with livestock production. So having that social license and having public credibility is extremely important for us to keep the industry going. And if we don't want to talk about it, we start losing consumers and we start losing that trust and the social license that is required for us to continually growing. And I don't mean to say that, producers don't care for their animals. They really do, but there's always good things that we can improve, right? And there's also on the side of the consumers, more information that we can be more transparent of what we're doing as far as raising those animals, so they are more part of what we're doing. So when we look into the association guidelines, so when we're producing animals, we have some sort of guidelines coming from veterinary associations or the AVMA. What are those guidelines are telling us? So if you go into the AABP website for pain management, we have a big document that talks about, what are we recommending? And unfortunately, we cannot be too prescriptive because we don't have anything that is label right now for pain, especially for those management procedures. So what AABP says or recommends is that we use scientifically validated pain management, or at least consider those a standard of care during the horning and disbudding procedures. And the reason why they say scientifically validated is because someone can just come and tell you, well, if you use ice on the dehorning side, that might help with the pain from this budding. But have we looked into that ice and how long we have to keep the ice in, how many times a day? What are the guidelines for using that type of management? Because the management is not only for drugs, it's for everything that we do. And they really talk about multimodal pain management. So we're not only treating the pain of the procedure itself, like how can we decrease the pain of the procedure of castration and dehorning, but also like long-term pain. So what can we provide that will help them over, the hours after they've been through that procedure? And then they also highlight that unfortunately there are no current approved drugs that we can use to provide analgesia in cattle. And because of that, we have to rely on Amduca and go to using that extra label. So if you look at castration, they will have some guidelines. If you look at this budding and dehorning, they will also have some guidelines. But all of those talk about using some type of local anesthesia so we can control the procedural pain, and then using some systemic pain relief so we can control the pain that comes after the procedure. The AVMA follows pretty much the same rule as the AABP. It's very similar what they say. They talk about using extra label drugs and how that is under the AMDUCA, and we can do that. But on this budding side of things, they also talk about maybe incorporating simple genetics. So we don't have to do those procedures, and therefore that is going to be removed from the question. And then they also mention the use of non-steroidal anti-inflammatory agents and local anesthesia, like we saw on the AABP. And the AVMA encourages the further development and implementation of improved practical analgesic and anesthetic protocols for bovine castration. And I think they do the same for this budding. So there is this need, there is this drive from our guidelines to find better ways for us to be able to provide some type of mitigation for those animals undergoing those procedures. Also, if we talk about some of the programs we have the National Dairy Farmers Assuring Responsible Management, the FARM program. So the FARM provides a framework for on-farm animal care for 98% of US and domestic milk supply. And they have some guidelines to what they want those farms to do. So they ask for pain mitigation to be used in this budding cows for any method. So if you're using cautery or if you're using paste, they want you to use some sort of pain mitigation. And it's also expected from the producer to work with the veterinarian to determine what is appropriate pain mitigation to use in this budding. And that can be, a lean way to what are we using? Are we using more management side of things, or are we using some extra label drugs? What is appropriate for my farm? However, again, there's no current FDA-approved drugs labeled for pain relief after this budding. There's no current approved drugs for the relief after um, castration. So we are very limited on what we can do, and everything that we can do becomes extra label use. So why do we have such a hard time approving drugs? Why do we have such a hard time using pain management in those livestock species, especially in cattle? Well, pain recognition can be very difficult, especially in stoic species. So cattle might not demonstrate pain as we would see, for example, in other species. So they are a prey species. They tend to hide when they're not feeling good. One, because they are scared of predators. They also don't want to show that to their herd. They have a very social dynamic that they don't want to show that they are not feeling good, which makes it really hard for the human eye to be able to say, yes, that animal is undergoing pain. We can think based on the procedure that they're going through that they are feeling pain because it would be painful for us. But for us to have a drug approval, we need to have a scientific method that is approved and is reliable and is repeatable. So that becomes a challenge because looking for pain can be very subjective. So we have some very subjective measures. We also have very different methodologies that we look for those behaviors. So we can do some live observations where we go out in the field, we look for some of the pain behaviors that we think, so some focal behaviors, but we can also do that as far as using video recording and then later on going and looking at those behaviors in camera so we can be blinded to the treatment that they received. There's pros and cons with both assessments. So live assessments, you're right there. It's easy to do. You don't need a fancy camera system. It's less time consuming that rendering videos and watching videos, but you also might be, influencing the behavior of those animals while you're in the pen. In this case here, I was standing in a pen with cattle. I would see them every day. I would stand in their pen for 3 hours. They didn't really care about me anymore. But every time that somebody new would come and step on the pen, they kind of would all hurdle up in a corner or even like go and try to, be on the face of that person, try to get that person to leave the pen. So depending on how we do that, we might influence the behavior of those animals. In the sense of a research setting where you're very controlled, you have those cameras, you might pick up behaviors that you wouldn't see on the live observation, but you have a very long period of time that you're doing things. So how do you select what time of the video you want to watch? If you're going to watch 24 hours for, I don't know, 26 animals and for over 7 days, for example, in the end, you have so much video that you need years to evaluate those behaviors. Also, we tend to do more of like individual pans so we can get some other measures as far as like their intake or some individual behaviors that might also affect how they are behaving because they are not housed as a social group. So there's pros and cons on both. And if you look at research in pain, we are kind of all over the place. Each person does differently, and we do what fits our project. And sometimes it makes it hard to be repeatable and reliable. Um, Also, the age of the animal can be a factor. So the behaviors that we see in mature animals are going to be very different from behaviors that we see in, week-old calves. So we need to kind of take that into account. So we try to do our best on reliability tests, validity, try to be more repeatable as we can, but it's hard to not be subjective when you're doing behavior analysis. So maybe in the future, we'll have some AI to help us on that. So until recently, we had no compounds that were specifically approved by FDA for the use of for analgesic use in cattle in the US. Luckily, now we have Benamine transdermal, and it's only labeled for pain associated with foot rot. So the way that they did this approval was they induced foot rot in cattle, and then they treated, and they were able to see differences in a pressure mat, which I will show to you later what that means. But basically, it was easier to show how they shift their weight when they have that foot rot and when they use the Benamine transdermal compared to um, a placebo, they saw differences on how much they put weight on that foot. So that's how they got that approved. Maybe this is a route for us to go and approve some more drugs in the same sense. But unfortunately, because it was done for foot rot, is only labeled for foot rot and not labeled for this budding, not labeled for castration, not labeled for other things. Everything else is used as extra label. It's also can be used in lactating dairy cattle, which is really nice because we have a lot of foot rot and foot problems in dairy animals. But again, everything that we use besides that is going to be extra label. Some other considerations when we're talking about why managing pain in livestock is so challenging is the time delay between drug administration and onset of activity. So if we're talking, for example, about lidocaine, it's a local anesthesia. We're going to infiltrate that into the animal, whatever we're going to cut. It's not going to start working right away. It's going to take about 10 minutes to start being effective. And when we're talking about the processing of animals, or for example, processing of calves, they don't want to wait for 10 minutes before they cut. So they don't want to, put an animal in the chute, apply the anesthesia, wait for 10 minutes, and then cut. That delays the procedure. That might cause distress to the animal of being in the chute for 10 minutes before you do the procedure. So that time delay sometimes is, one of the things that they are like not very willing to provide some of that pain management. And then there's some other drugs that are controlled for a longer period that will also start later, so we will not take that procedural pain off. The other thing is inconvenient routes of drug administration. I brought an example here of Benamine. So Benamine in the US is only labeled to use in IV, so intravenous. So you need to get access to that jugular vein to be able to deliver that drug. Um, you need someone with a lot of experience or a veterinarian to do that, which becomes somewhat of an inconvenient, right? So if we're talking about, for example, animals in a calf range or animals in a feedlot that you have a doctor that is not a veterinarian that is treating them, they might not feel comfortable using that drug intravenously. And then we have short drug elimination half-lives that necessitate frequently drug administration. So if we're talking about lidocaine, about 2 hours, max 4, it's gone. So you might take care of the procedural pain, but then you don't take care of the pain after that. Or even when we use, meloxicam to treat the pain after, how much time after we need to redose them, and then how we do that on animals that are in pasture, for example, makes it really difficult for producers to keep giving that medicine in a way that it's going to cover the period of pain of that animal. And then cost of drugs and meat and milk withhold periods. I would say cost of drugs depend on the drug that you're using. Meloxicam is very cheap, so it's more available for us to use. But I think the meat and milk withhold periods is what makes it really difficult. So right now, for veterinarians, they have to submit a request for FARAD to see how long the withhold period is. And unfortunately, I think for meloxicam is about 42 days in cattle right now. So if that animal, for example, the animal I showed to you guys in the first slide where he had BRD, if we want to ship that animal, we don't want to wait for 42 days. So they might make the decision of not to treat that animal because it's going to slaughter or to emergency slaughter, and they don't want to wait for 42 days. So why are there so few analgesic approvals? Well, you just saw that we had meglumine transdermal being approved recently only for foot rot. And that is because the FDA recommend that the indication of labeling for pain is based on control of clinical signs of pain associated with a disease. And they encourage the use of validated methods of pain assessment in target species. We don't have a good validated method. If you talk to FDA, if you've been through studies with FDA, there's a lot of hoops we have to jump through to get a validated method. And unfortunately, right now, we don't have anything that is good for all types of pain. So, for example, the pressure mat might be really good for foot rot, but might not work as well for castration because it's not in one foot, right? It's on their scrotum. So the pain is different. How they compensate, how they walk is different. So we don't have a good thing that is validated for all methods. If we're talking about approving, for example, antibiotic, it's way easier because you see a decrease in, the bacteria load. You can see a decrease in fever. But in the case of pain, it becomes really hard to have a validated method that is reliable, is repeatable, and we can use for all types of pain. So that's why we have, kind of targeted into foot rot for the meglumine transdermal. Also, you're going to see that most of the drugs we use extra label are label for decrease of fever. And that is just because it's way easier for us to prove that we can decrease a fever with a medicine than to, provide that is decreasing pain. So a fever, you can just, use your thermometer. They had a fever, you use the medicine, and now you have a decrease in the fever. And it's not the same in pain. It's just very hard and very subjective. Okay, so what are the hoops we have to go jump to get to use those drugs? So extra label drug use is permitted only by or under the supervision of a veterinarian. So our producers cannot just go there and buy what they think is going to work for their herd. They need to work with a veterinarian. They need to have a supervision of a veterinarian to use that drug in an extra label manner. It's also allowed only for FDA-approved animal and human drugs. That makes it really hard. You know that human drugs sometimes are way more costly for us to use. So, for example, if we do a trial with the FDA, they require us to use human lidocaine because that is the only lidocaine they have a label for. So it makes it very strict on what we can use for those animals. They need to have a valid veterinarian client-patient relationship. So you cannot just call your vet, a producer cannot call the vet and say, I need this drug for pain. It needs to be a vet that have seen their herd, understand what are their management procedures, what they're doing, what they're going to need that drug for. And it's only for therapeutic purpose. So animal health is suffering or threatened. It's not drugs for production use. So you cannot use that to enhance the production of those animals. And that's why using only production measures to approve a drug for pain is not something that the FDA is going to be okay with. Because we're going to look into some of the differences we can see in production measures. And extra label use is not permitted if it results in a violated food residue or any residue which may present a risk to the public. So that's why we have to consult FARED, make sure that at least the literature that we have has some sort of indication of how long that drug is going to stay in the system of that animal, and it's not going to end up on the food that we're producing. So what are some of the analgesic options we have? So we have local anesthetics like lidocaine. We already talked about that. I put the example here of the human lidocaine that is FDA approved. Non-steroidal anti-inflammatory drugs or NSAIDs, we have flunixin, so that's the Benamine. We have the IV option or injectable option, and also the transdermal. The transdermal end up being a lot easier to apply since you don't have to find a vein to do that. You can just put it on top of the animal. We have ketoprofen. Ketoprofen has been recently approved. You're going to see on a table I have in the next few slides. We have phenylbutazone, meloxicam, but all of those are not labeled for pain control. They're labeled for decrease of fever. And then we have sedatives and analgesics, which is like xylazine, romifidine, and medetomidine. We have dissociative anesthetics like ketamine, and then anti-epileptics like gabapentin. So here is just a table. I'm not going to go over all this table with you, but you'll see some of the drugs that we have available. You're going to see that most of them don't have a label for pain. The only one is flunixin meglumine, which is our Benamine transdermal for foot rot. And most of them are, the indication is either an anti-inflammatory or a reduction of fever. And then some of those don't even have a FDA approved. So for example, aspirin has been in the news recently on how people are using it, and there's no formal FDA approved, but it's kind of sold over the counter. So how do we go about that? So what are some changes to the current landscape? So based on the current landscape used in the United States, we did researchers did this survey where they look into veterinarians and also producers and how they're using drugs, how often they're using drugs, what are the reasons they're using drugs, why are they not using drugs. And what they found is that there's a shift in attitude in the past 10 years. And they saw this change in farmer and veterinarians, and they also saw a change in practice and operation protocols. So they cited that basically the changes in the attitude of the veterinary really influences how the producers see the use of analgesics, but also if they have a change protocol, if they receive a change protocol from their veterinarian, they're more willing to follow that. And that has increased the use of analgesics in the past 10 years. They also put as a second the improved growth and performance as very important, but it's not the main driver. So we always thought that all the producers wanted is to see some performance enhancement, how they can repay for the cost that they're having to, providing pain relief. And that's actually not the first driver. The first driver is their attitude and changes in protocols. And then the third is that new evidence of analgesic effectiveness is coming out from research. So that has made a big change for them. And then the change in the producer's perception of pain. So, as I said before, it was passed from generation to generation to generation that those animals didn't feel pain. And now we are educating more that, yes, they do feel pain. So there's a shift, a change in how they have that perception of pain. And then also kind of teaching the behavior of the animal, what are the things that they should look for, what type of procedures and diseases cause pain, and then go from there. And also, they want to maintain the consumer confidence in livestock production. So they want the consumers that are buying their products being able to say, yes, I have confidence in livestock. I want to keep seeing that industry grow. So some of the common reasons for stopping the analgesic use, they have very small respondent numbers, so take that with a grain of salt. But one of the main things that they said is concern about extra label drug use. And you can see the percentage there with the producers and veterinarians. So about 50% of veterinarians are really concerned about using any drug as extra label drug use. Um, Also, the cost, producers are way more concerned about the cost than veterinarians. And then the drugs don't last very long, so why would they give it anyways? There's a lot of producers that kind of go that route. They do not improve health and performance. So you see some of the producers and veterinarians kind of they only look at health and performance. They don't look at the pain itself. And then inconvenient routes of administration. And that mainly came from producers where they're not comfortable using those IV products. So I thought that this slide was really nice, and I got that from Dr. Cotia. And basically, the chicken is about to put an egg, and she's like, I'm not gonna put an egg, I want an epidural. And the farmer is like, what are you talking about? Just lay eggs. And it's kind of like that. It's like we know it's painful, but we're not providing anything, and they unfortunately cannot say that to us that they want some type of pain relief because there's no meaning to talk to us about it. So how do we access pain in cattle? So we have many different measures, and you're gonna see the array of things that we've tried. I think researchers are really passionate about as assessing pain and also like using that for decreasing that pain in those animals. So we have electrodermal activity, we have chute exit speed, so basically how fast the animal exits the chute after we do any procedure that is painful. We look at growth and performance. That is important for the producers, so we try to include that. Sometimes we see differences, sometimes we don't see difference. Most of the time we don't see differences, but it's something that we always include. And the reason that we don't see differences is I tend to say that when I'm stressed or I'm in pain, I tend to eat more. So I gain weight instead of losing. So sometimes the animals can go that way too. So if we look at this graph, for example, think about the week one is the week that we castrate the animal, and we might see, a shift in weight where they're not gaining as much weight. But after week two, they start gaining weight and they look good, and they're going into week four, they're just back to normal. But when we look at their affective states and their normal behavior, we see a shift down. So even though they are not feeling good, they're still gaining weight, and that happens very often. So we have a hard time finding growth and performance increases in those animals that we treat for pain. Other ways that we can look is behavior. So we have some automated ways like using accelerometers. We can look at stand and lie behaviors and try to correlate that with how much pain those animals are feeling or how much change from their normal behaviors after they had a painful procedure done. So when we use accelerometers, what we can do is just have this big overview of their behavior. So in a 24-hour day, for example, the animal is gonna lie, and then it's gonna stand, and then it's gonna keep standing, and then it's gonna decide to lie again, and then stay lying. So over the period of 24 hours, we might end up with a timeline like that where they spend a lot of time up and down, up and down. And when we look at those times and we combine them, we might have what we call lying bouts. So this is how many times they shift their position to standing and lying. And in my example here, we had 16 lying stand bouts. But when we look at their time of lying down combined, we might have 65% of their time. So that probably could tell us something, but maybe not. But the amount of times that they make that transition from lying and standing is really important, especially when we're talking about castration, because of the way that they stand up with their back legs first. They tend to put a lot of pressure into their scrotal area, which when you have a cut there or you have a bend there, it will stretch the tissue and cause a lot of pain. So what we saw in some of our studies, and this is one of our students, Maddie Menke, We look at band castration, and what we saw in this study, we look at the lido bands, so bands with lidocaine and then bands without lidocaine. On the x-axis here, we're going to have time point in days, so it goes every 7 days we had a measure. And then on the y-axis, we have a probability of granulating tissue. So that tissue right here, when the band cuts through skin, and you start seeing that healing wound coming forward. So think about that band castration happened on day 0, and then every day we would go and check if the band cut through the tissue. And if they cut through the tissue, we would say yes. If it didn't, we say no. So we start seeing that the band cut through the tissue at day 21. So if you think about, it's a lot of weeks after we actually apply the band that we start seeing. And by day 49, about 89% of the animals had that band cutting through tissue. So we might have animals going, 50 something days and they still didn't cast, so they didn't lose their scrotum. So when we overlay that with behavior and behavior bouts, so here we have study days. So here we're going to have the bending where we bend day 0, and then we follow them for 45 days. And on the y-axis, we have line bouts. So how many times they did that up and down, up and down. And what we saw is that by day 21, they pretty look very similar, right? They have about 15, 20 bouts per day. And then once we hit 21 days and those animals start having that tissue, that band cutting through tissue, we start seeing some separation between animals that had a lidoband, so a band that was infused with lidocaine, and our control bands. And we saw that the animals that had the lidoband, they were way more willing to do that movement from down to up, right? And putting a lot of pressure into their back legs and their scrotal area compared to our control groups. So having a better visualization of the behavior data, it's kind of trying to tell a story of what's happening. Looking at just the behaviors here on line standing, I don't know what exactly it means. But when I overlay that with when we start seeing that granulating tissue, it actually makes a lot of sense because we know it's painful to stand up with a wound between their legs. So other things that we can do is looking at focal behaviors like tail switching, foot stamping, wound licking, looking at flank, head shaking, and head scratching. And those are mainly for castration. If we have, for example, this budding, we might have a lot of like head scratching or vocalization, other behaviors. But to give you some examples, you're going to see a lot of behaviors going on here, but he just did a foot stamping. He's going to look at flank. You can see the tail is moving. And then on the next video here, you're going to see a behavior directed to the wound. So he's licking that wound. It's bothering him. It's causing him distress and pain. What we need to be careful is those animals were in an indoor barn. They had fly control. But when we have animals outside, our chance of having tail swishing or movements of the tail, it's very high because they're trying to keep the flies away. So we need to be careful on how we look at those behaviors because it might not be an indication of pain, but an indication of distress from having flies in their environment. Other things that we can do is, for example, looking into some physiology measures like cortisol substance P. So what we see with some of the trials we did, so if we look at time point on the x-axis here in relation to when they got castrated, you're going to see that half an hour, 1 hour, 2 hour, 4 hour, and so forth. And then on the y-axis, we have cortisol different from baseline. So basically, we took a sample on the baseline, and then whatever number that was, we use the day after and all the other timelines as a differential to that baseline. So what you can see is that they do, after they get castrated, they do have a big spike on their cortisol, and that is probably at peak on 30 minutes and then starts coming down. And if we look at 4 hours, we might not see anything because we just have that big peak and that goes away. So it's very timely. We need to be very timely, right, to get that peak in cortisol. And sometimes, just because we're handling the animal and we're collecting blood for the first time, they will have a peak, even if they are in our control group or the group that didn't got castrated. So we need to be careful on how we look at cortisol. Sometimes can be a very good measure, and sometimes it might not tell us anything. It will change with age of the animal on how they peak, so we need to be careful. And then we have also substance P that has been used to as a marker for pain and also inflammation. Other things we can do is EEGs. We can use ogometers that basically are going to put a pressure into the location where that animal has pain. And when they move away, you're going to see how much pressure you had to put. So you might see differences when you're treating animal for pain or when they are animals that didn't got castrated and animals that got castrated. Other things that we use is thermography. So thermography is gonna find differences in cutaneous perfusion. So pain causes alteration in sympathetic tone. So basically, it will result in all of the superficial blood going towards the principal organs and decreasing the temperature of the skin at that time. So it rises to quantifiable changes in localized body temperature. So if we're talking about at the time that we do castration, we might see that decrease in temperature. And then over the days, as inflammation takes place, we start seeing that increased temperature back in where we caused that pain. But we have challenges with it. If we have animals exposed to sun, or one day we have a very sunny day and then the next day we have a rainy day, that can affect how our results come off. And even though the camera readapts to the temperature of the day, the exposure to sunlight might have some effects into the temperature itself. Pressure mat is what was used for foot rot. It basically kind of follows the animal. The animal walks through a mat that has some sensors, and those sensors can pick up on weight that they're putting in each foot, their gait, how they are shifting weights. So basically, the computer will allows real-time recording of all the phases of the stride. So we have duration of the stride, length of the stride, force throughout the stride, force distribution, and if they have any moments of inertia. And this will allow to completely characterize how they're walking. So if you have a foot rot, you know it's painful in that limb. They might not put so much pressure in that limb. Once you give them some sort of pain management, they start putting more pressure into that limb. So it's a more objective measure compared to some of the others that we already talked. So what are the challenges that we can have? Well, if you use very small animals, like I do in my trials with calves, they tend to do some play behaviors on the mat, or you have to kind of guide them with a bottle, like I have here, and you're gonna see that calf just jump and he moves his head. This is not a good walk. He would have to walk again for me to get a very straight um, gait. They cannot jump around. They cannot step outside of the mat. They cannot do the play behavior. Otherwise, I don't get a good measure. So it is an objective measure, but it's hard to take depending on the age of the animal, depending if that animal is used to humans or not. So we use Brahma cattle at some point. They would just sprint towards the pressure mat, and then our measures would be really hard to get accurate measures from those animals. We also have in behavior, we can do facial grimace, we can do pain scores, composite pain scores. So an example is the GLIRP one, that they look at some of the grimace scores that those animals can present when they are in pain. So you can see some of the examples that they use here with lameness and post-surgical pain. And they look at ears, eyes, face muscles, and the muzzle. So one example that I can give from one of my projects is this animal got castrated without any pain control and also got despud without any pain control. So you can see that some of the things that we're looking at those cows, we can also see in the calf. So he has a very dilated nostril. He has those bulging eyes, and then he has his ears were very, tense and backwards. And my students were blind to the treatment, so every time we would walk him through the pressure mat, they would be like, "This animal doesn't walk, he doesn't want to do anything." And in my mind, I'm thinking, yeah, if you got castrated and this bud without any pain relief, you wouldn't walk either. So after that passed and they were unblinded, I showed them this picture and they're like, "Oh my God, how we miss those tiny little facial expressions." And I'm like, well, you're not looking for it, right? So it's something you have to be looking for to see. If you're just tired or if you're just trying to get by the day, you might miss those little things. Also, this is a work done in Brazil. They have a composite pain scale where they give scores to each behavior, and then a sum of scores, if they pass a threshold, is an animal that is in pain. And they will use some of the behaviors we already talked about, locomotion, um, foot stomping. You can see in there they have wound licking. So a lot of different behaviors that they put together in a composite pain scale, and then you have a summarized score that you can use. But the interpretation can sometimes be very variable. We're talking about eustress, where the animal is just playful and their cortisol is rising up, while are we talking about distress, where they're in pain, they are afraid, and they are having that spike in cortisol and changing their behavior. So sometimes it's like a fine line that we have to walk through, and our interpretation of the behaviors or the measurements we take can be very hard to do because we don't know exactly where we are. Are we on eustress? Are we on distress? And then handling animals can always cause distress. So every time we blood clot them, every time we enter the pen, we might alter their behavior. We might alter which hormones they are secreting, and that can be changing the interpretation that we have. So what are we doing to move forward? What us as researchers and scientists trying to do? So recently, K-State has been partnered up with the Food and Drug Administration, so the FDA. We created a Animal and Veterinary Innovation Center at K-State. And what we're doing is we're working very closely with FDA to produce models that can be used by companies and researchers to approve drugs. So how can we develop something that is reliable enough and repeatable enough that can be used for us to approve? Because FDA wants to approve drugs, we just need to find the best way of those models to be able to get those approvals. So that's what we're doing right now. We're working very closely. We're trying to come up with models. We're trying to come up with measures and protocols that can be followed that will allow us to approve drugs. So we are first validating outcomes or their combination as an effort to facilitate pain management drug approval, especially for painful management procedures. So we're looking into castration and disbudding for cattle. We're looking for castration and tail docking in pigs, and we're looking for castration and foot rot in goats. So we're targeting three different species. One is a minor species, goats, they don't have anything labeled for them. So it would be amazing if we could get something approved. And we're collaborating again with the FDA and also North Carolina State. So with that, I just want to thank all the sponsors of our research here at K-State. I also would like to say that nothing is possible without graduate students. So those two pictures show some of us faculty and then all our graduate students and some undergrads. And they're very important to do this type of studies. They're very time consuming. You need to be there every day. You need to make sure that your animals are taken care. So having them has just been amazing, and seeing them go through it and learn so much has been the highlight of what I'm doing. So just a big thank you to everybody. And with that, I'll take any questions with this beautiful Kansas weather that we had over one of my studies where we had calves and hutches, and then we started having tornado warnings while we were collecting data. So thank you so much for having me, and I'll take any questions.
Thank you so much, Eduarda. So our first, we have two questions related to meloxicam, so I'll put those
Okay.
together. And the participant referred to it as Medicam. So just a reminder for our audience that that's the brand name for meloxicam, and this is an NSAID. And the participant asked, is Medicam not labeled for pain at dehorning in the US? Um, in Canada, we use Medicam on label for the pain associated with dehorning and disbudding, acute mastitis, and C-sections. And I know that you did mention later in your presentation that it is extra label in the US. So I wonder if maybe you can speak to why meloxicam is available in Canada but not in the US, or if there's any movement towards FDA approval of meloxicam in the US.
Yeah, so Canada has, I think, multiple products on meloxicam. So they have different, I think they have oral solution, they have tablets that are approved, and there are label for the use for those types of pain, management pain. Um, Unfortunately, in US, we don't have anything that is labeled for pain. So we use everything in extra label manner. I don't, I cannot talk on how is the process of approving drugs on Canada. I just know there are different agencies that do that. So Canada has it approved. Unfortunately, for US, we still don't have that approval. What I've heard is there's some companies looking into have that approved for some of those management painful procedures. So hopefully at some point we're gonna have that. I just don't know exactly where they're at on their process. It's a long process. I've heard that take about 5 years for you to get an approval because you have to do pilot projects first. Um, the FDA has to approve the pilot projects, then they have to decide what are some of the measures or outcomes that they're interested and they think are valid for pain. And then with that, you have all the approval part where you have to have the safety of the medication, you have to prove the withdrawal period time, and then you have to do the clinical trial to actually prove that that is effective and is clinically relevant for that drug. So it's a long process. I don't know where we're at on that sense, but I know there's some companies looking into that.
Eduarda, I'm going to pause our Q&A really quickly just because it's almost 9:10 and we just have some closing remarks for
Okay,
anybody who needs to drop off. And then I want to come back to Q&A because we do still have
sounds
some.
good. Do you want me to stop sharing, maybe?
Yes, if you could, that
Okay.
would be great. Okay, so I want to thank Eduarda again for speaking. We're going to get back to the Q&A in a second, but for anyone who needs to drop off, we just want to thank you for attending the webinar. We're going to be posting a recording of today's webinar on VAFAW's website in the coming days, and certificates of participation for CE credit will be emailed over the next week to veterinarians and veterinary technicians who attended. A reminder to please fill out the short survey that will show up on your screen after the webinar ends. If you found this webinar beneficial, please consider becoming a VAFA member or making a donation at www.vafa.org to help us to continue to provide free educational content on topics impacting farm animal welfare. I also want to mention that we plan to host a webinar that will focus on the clinical application of what we've discussed so far about pain, taking into consideration these on-farm challenges that Eduarda has discussed today and these current analgesic limitations. So stay tuned and thank you again for joining us tonight. And now we will get right back into the Q&A. Okay, so going back to our questions. Going back to meloxicam, you're a very good person to ask this to because you work with Dr. Kutzi. Someone asked, Dr. Hans Kutzi recommended the routine use of oral meloxicam decades ago for several days for post-dehorning and castration pain relief. Are you aware of any large commercial producers anywhere that adopted and routinely employed this protocol?
That's a great question. And yes, he has been very vocal about using meloxicam. Um, I I am not aware of large producers that use that. I think we are way ahead on the dairy side. I work mainly with beef, so beef is behind, like very behind dairy. I think dairies are more willing to provide pain management, and having some auditors coming in and doing assessments of welfare of those facilities have helped in ensuring that they are using that. But unfortunately, I on the beef side, we might have some producers that do at time of castration or even at time of branding, because they do castration, branding, and vaccines all at the same time. But I couldn't tell you like a large, big producer that uses meloxicam on their protocol. It's going to be very variable, and I think the veterinarians are being more vocal about it, about using meloxicam.
I think that is a really good question because we know that the pain that follows these procedures, it's not, even if we give analgesia at the time of the procedure, that this is inflammatory pain that can last for weeks or months. So, as a follow-up, I'm wondering, do you think that there will be a movement towards multiple dosing protocols in the future? Because even, dairy producers that I know, I don't really know many people who do multiple dosing protocols. And with dairy, I understand with beef calves, it is more challenging in terms of how the operation works. But in terms of dairy calves, oral meloxicam is something that's very easy to administer. And I don't know if is there any research about multiple dosing protocols, the safety associated with it, or the most efficacious time point when you could administer the drugs?
Yeah, I don't know, Abby. I know there's some concerns about safety of using meloxicam, especially in young animals, which are the ones that we're doing castration and dehorning. So I think people are going to become a little more comfortable once we have something approved, because the companies will have to prove that it is safe to use on those animals. Um, as far as building protocols, I am not, I don't know if there's anybody that has a protocol on multiple dose. I think that might be okay and easy to do in, yeah, dairy farms or calf ranches. So where we're raising the beef on dairies and our replacement heifers, because we feed them every day, twice a day. So it's easier to come in dose. I also, I might be wrong here, they might find it easier to do if it's a drench than a bolus, just because I've heard even from our students that, oh, we don't do the bolus because they spit it out. And I'm like, well, we're probably not doing it right, you know, but I've heard that. So sometimes the drench might be easier, as you're putting the milk bottles down, you also drench them as you go through it. So I don't know, maybe if we have more available products and different types, that might help with those protocols that do multiple dose.
Um, okay, the next question is, how do you see the progress towards high percentage of polled genetics in dairy cows over the next 5 to 10 years? What are the barriers?
The barriers of pool genetics.
Yeah.
Um, I don't know. I think one is I think we bred too many years for production. I think that's what I think the barrier is, if they see that that is affecting their production. Um, I think we pretty much on the dairy side we bred for, you know, high yields and a lot of, conformation and high udders, that type of thing. So I think the only downside I see is that. But with the use of beef on dairy, we have seen a shift in those animals being pulled because of the genetics itself. So that is a plus. That is a plus of adding beef on dairy. I think it's also a plus that now we have less animals that will die in the farm without having a purpose. Even though, they're going into a yard and they still have a purpose, and we're not just having that animal for the milk, which was a very, wicked problem on the dairy side. So I think we're moving towards that slowly, but we are. I think as we get more pushes from, the dairy side, I know California has been very big on the pushing for pool genetics. They had a couple campaigns on, this is what happens to your animal when it goes through this budding. So we might see that more on the next few years. But I think the downside is probably the cost of doing research on genetics. It's usually expensive. And then if causes any downsides on the production side, we might see a big pushback from the producers on not wanting to use that. But I'm hoping to see more that work in the future.
How is pain not easy to detect physiologically? For
I
example,
can't hear you, Abby, for some reason.
oh, can you hear me now?
Very low, like your volume is down for some reason. Or maybe it's my computer.
No,
I'm
I
not
hear
sure.
it. Oh, there, you're back, Abby.
Am I
I can hear
back?
you. Yep.
Mhm.
Okay. Okay. How is pain not easy to detect physiologically? For example, can't you detect pain via labored respiration, elevated heart rate, and elevated blood pressure?
It's very variable. Unfortunately, the variation that we have between animal to animal is huge on those aspects. So we have a hard time with the amount of variation, for us to find differences statistically is very hard. I would say, like, if you look at the animal, you're going to be like, yes, this animal is in pain. But because we have so much variation, trying to prove that scientifically has been a challenge. We also have a hard time using wearables on those animals. So, for blood pressure, unless we put something that is a catheter with the measurement inside, we have it. We also have some errors if we try to do that, without being invasive. And then with wearables for heart rate, we also have a lot of variation into those based on conformation of the animal, the type of product we are using. Battery life is a big problem. And then everything that we put on them, we we cause some differences, and then we might, get even higher variations of just having something in the animal if they're not used to it. So I think, yes, we think it would be easier. Unfortunately, we have so much variation that when we try to see that as a scientific method or a p-value, because of the variation, we have a hard time to using those measures.
Just too easy if we had a nice subjective
I know.
physiological
I'm
measure.
like, can we
And I
just use
mean,
something, I don't know, like an Apple Watch? It would be awesome. Yeah,
and
we're
like
not
you
there yet.
said, with even just putting, it being more invasive, having to put something on an animal, the stress, we have all these confounding factors. Like even
Yeah.
when an animal's very excited in a positive way, we might
Mhm.
see these variations for sure. Um, is there a good source or sources to learn more about assessing pain in cattle that you would recommend?
Um, I know there's a couple published papers. I would have to go back and double check who wrote those that talk about different methods of um, assessing pain. There's some that use composite ways to do it. Um, so there is some resources about all the different types of ways you can assess pain. But I don't know, like on top of my head, something that would be very complete and it will have everything that you need. You might have to, modge podge different research papers that use different techniques.
So maybe there's no kind of go-to
Yeah,
resource,
and
but maybe doing a good literature search on.
yeah, and we're still like developing a lot of those things. So there's always something new coming up. I think the route we're going right now is trying to get more automated things, like how can, you know, image classification or artificial intelligence, machine learning, how can they help us to make those decisions or to find behaviors without being super invasive. So hopefully in the next couple of years, we're gonna have some better measurements.
And what are your thoughts on using pressure algometer to measure disbudding pain so that we have a more objective measure for pain?
Yep, we've done that. It works okay in some instance, and it works terrible in others. So for baby calves, it didn't really work for us. They anticipate that you are coming up with the pressure, and they start removing their head before you even touch. And then the other thing is they get used to it, and even when they have pain, like you can see that it's open, they still don't move because they're afraid to like move. They kind of like freeze. So you get wrong measurements. What I've heard is some people cover their eyes so they cannot see you coming with the MNT. But I'm afraid that you might disturb their behavior by doing that too, because now they cannot see. So, they might misrepresent their behavior. So we have had a hard time with MNT. Um, Again, my work with animals you have in a shoot that are older, it might not work really well with really young animals. And then on castration, it works horribly because everything you touch on the scrotum is they don't like it, so they're gonna move in. You can even have some other place that you try to use so you can see sensitivity in other parts, but we had a hard time to find differences on MNT.
All for our questions. Thank you so much. Thank you for staying up extra late to answer all these questions. Thank you so much for your presentation. Thank you everybody for attending tonight.
Yeah, thank you so much for having me. This is really fun to talk about research. And if you guys have any questions that you want to email me, or if you are researching that and you need someone to talk about, I'm very passionate about animal welfare. I'm very, very passionate about pain. So I'm always open to talk about it.
Thank you so much. Such an important topic. Thank you so much.
Thank you, guys.
Good night, everyone.